sir, I am Daniela Arnan from BSN2K. So today I will perform the cardiovascular and peripheral cardiovascular assessment. So good day ma'am, my name is Daniela Arnan from Naga College Foundation. I'm your student nurse for today. So I will be performing the cardiovascular assessment. So before that, provide the privacy of the patient, then gather all the materials, then perform hand hygiene, and wear gloves. I will be assessing your heart and circulation. This will involve inspection, palpation, and listening to your heart. Please let me know if you feel discomfort. So, I will begin to inspect the precordium. So, I will only expose the so first is I am observing the visible palpation or hips or over the chest wall, then inspect of the precordium. Then no obvious hips noted, but further assessment is needed. So next is I will now assess the jugular pressure. So I will elevate the bed into 30 to 45 degrees. So now I will assess the jugular venous pressure. So I'm expecting the jugular venous distension. So I can observe visible jugular venous distension at 45 degrees. Increase central venous pressure. So next is the apical impulse. So I will now palpate the apical impulse. It is located in fifth intercostal space, 8th clavicular line. The apical impulse is displaced downward and laterally, suggesting possible cardiac enlargement. So next is I am palpating the precordium for trills or hips. No palpable trills noted. So next is I will now assess peripheral pulses for rhythm and symmetry. So for the radial pulse are present, slightly irregular and symmetrical. The carotid pulse, one side at a time. And next is the femoral, popliteal, then the posterior, then dorsalis pedis, then the tibial. Okay, so I will the next is I will now auscultate the heart using the Z sound, using the stethoscope. So first is the aortic area. I'm auscultating at the second intercostal space, right sternal border. Next is the pulmonic area, second intercostal space, left sternal border. Third is the Erb's point, third left sternal border. The fourth is the tricuspid area, intercostal space, left sternal border. And the last is the mitral area, fifth intercostal space, mid clavicular line. So, I distinguish S1 and S2 heart sound. So, next is the capillary refill. I will now assess the capillary refill. Capillary refill is delayed at more than 3 seconds. So, next is the skin assessment. So, I am assessing the temperature and moisture of the skin. So, extremities are full and pale, suggesting reduced circulation. Next is the edema. I will now assess the beating edema. Rest for 5 seconds. And there is two plus beating edema on both ankles, indicating moderate fluid accumulation. So, based on my findings, jugular venous distension, displays apical impulse, S3 gallop, and bilateral beating edema, the patient is showing signs consistent with possible congestive heart failure. These findings correlate with her symptoms of fatigue, edema, and orthopnea. That concludes my cardiovascular and peripheral vascular assessment. So, after that, after care on the patient, thank you, ma'am, for your cooperation. So, remove gloves, then perform hand hygiene. Then, after there on the materials used, then document all the findings gathered, then report it to the attending physician. Thank you.